Okay, good afternoon, everyone. I'd like to call to order the salary board meeting for today, April 19, and we'll open with a roll call of members present, please.
Commissioner Eichelberger.
Present.
Commissioner Fauci.
I'm here.
Commissioner DiFilippo.
Present.
Controller Whitcomb.
Here.
Okay, thank you. At this point, we open the floor for any public comment in regards to issues for the salary board. Is there anyone wishing to address the salary board? So we have nothing. Okay, so we'll move on to item 4. We have the salary board actions, so documentation in hand. So unless there's questions, I'll entertain a motion on that.
I'll make a motion to approve the salary board actions as presented.
I'll second that motion.
It's moved and seconded. All in favor indicate by saying aye.
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 Motion carries. We have also the minutes, the proposed minutes of April 5 of this year also in hand. We'll need action on those for approval.
I'll make a motion to approve the minutes of April 5.
Second. It's moved and seconded. All in favor indicate by saying aye.
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 Motion carries. Okay, is there additional business to come before the salary board? I see and hear nothing.
Make a motion to adjourn.
So we have a motion to adjourn, and we stand adjourned. Thank you. We'll move into the Board of Commissioners meeting for today, and opening with the pledge of allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. We'll call the meeting to order again today, April 19, at hour 2 p.m. If we have a roll call, members present, please.
Commissioner Eichelberger.
Present.
Commissioner Fauci.
I'm here.
Commissioner DiFilippo.
Present. Okay, at this point, we move on into the period for public comment. It's available at every annual meeting of the commissioners, every public meeting of the commissioners. Do we have anyone for public comment?
I think this is Chris Rafferty. I did tell him mute. I think it's Chris. It's 2. You want to ask again?
So the 0789.
Yes.
0789, is that Chris?
Yes, sir.
Okay, all right. I'm assuming you don't have anything additional for us, we'll get to your item number 6.
Yes, that's correct. I have nothing additional.
Okay. Okay, so we will, seeing no other, we will move to item 4, which is the action on the minutes of April 1 and April 5. We need a motion.
I'll move to approve the minutes of April 1 and April 5.
Second. It's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Thank you. Item 5 is the personnel transactions that were discussed previously, documentation in hand. Are we prepared to take action on those today?
Move to approve the personnel actions.
I second that motion.
Okay, it's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Okay, item 6 is the approval of the Housing and Redevelopment Authority's annual action plan amendment to Community Development Block Grant. This is reviewed at Thursday's workshop. And Chris, I'm assuming you had nothing additional to add, but you're available for questions.
Yes, Commissioner, I'll ask any questions,
Okay.
and answer any questions you may have.
Anyone wish to address Mr. Rafferty?
No, I'm good, thank you.
Okay, very good. All right, in that case, thanks, Chris. We will we'll take action on this. We will, I'll entertain a motion.
I will move to approve the annual action plan amendment to the CDBG program as reviewed at the April 15th workshop.
Second.
Moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Thank you, Chris.
Thank you.
Okay, item 7 is the issue of the letter of support regarding Harrisburg International Airport. We have copies of a letter in hand, a draft letter in hand. This is to indicate support for Sarah's Susquehanna Area Regional Airport Authority's pursuit of an improvement project to improve cargo air cargo access at the facility. These are economic drivers, so we would need formal action to adopt that letter.
Make a motion to approve letters of support for the Harrisburg International Airport Air Cargo Access Improvement Project under the Susquehanna Area Regional Airport Authority.
I'll second that motion.
Okay, it's moved and seconded. All in favor, indicate by saying aye.
Aye.
Motion carries. Okay. Item 8 is the letter of support in regards to Sadler, I believe it's Sadler Health Center. We just have a formal name, but there is a request for a letter of support here in regards to grant dollars for remodeling of new building space. And I have two names here, Manal Elharak and Laurel Spagnolo. Either one of you wish to address us with anything additional? We have the letter.
Yes, thank you, Commissioners. We are so happy to be with you this afternoon to discuss our project and what we're looking at for review. So I'll turn it over to our CEO at the Sadler Health Center, to kind of discuss our project with you.
Thank you very much, and thank you for inviting us today and for taking time to hear about our project. I do have a brief presentation if you want me to go over that, or I can just speak to it depending on how much time we have.
Well, we've had an opportunity to look at it, but please take all the time you'd like.
Thank you. It should not be too long. Let me know if you can see my screen. So I'll just do a brief overview about Sadler and the role that we play in our community, as well as what we have planned for this project. So we're a federally qualified health center. We have locations in Carlisle and Lloydsville and Perry County. We are designated by the federal government as a federally qualified health center serving primarily Cumberland and Perry County. The majority of the services we offer can be summarized in medical services, including adult and pediatric services, dental care, behavioral health services. We have mental health services, substance use programs, as well as psychiatry. We also offer a lot of additional services to help support our patients in the vulnerable community as a whole, such as affordable access to medications, HIV and STD testing, and insurance enrollment. The patients that we serve, you can see that 58% of them are below 100% of the federal poverty guidelines, and the majority of our patients are below 200. That's what we're designed for, and that's who we are designed to serve. Approximately every year we serve about 9,500 to 9,600 patients. And we've been increasing the amount of visits and what we do for each patient progressively since 2017. Our COVID response has been instrumental in the community, and we serve a role as public health shock absorbers, and we work with our hospital partners to reduce emergency visits. And you can see here that since the pandemic started, we offered over 29,000 visits. Our teams work relentlessly to make sure that our community is taken care of. We were one of the first to begin offering COVID testing, as well as of this last Saturday, we're almost at 3,000 COVID vaccines that we've offered just here at our site in Carlisle, and a few vaccine clinics that we've done in Perry County. We're also working on establishing mobile services capabilities, both related to the pandemic as well as other health priorities. Every year we do a needs assessment, and our recent needs assessment indicated that we have several pockets that we could address within the service area that we're responsible for. But the highest need stood out to us being in the eastern side of Cumberland County, particularly in Mechanicsburg and the zip codes surrounding that. The area is growing rapidly, and 18% of the population is low income. There are 6,000 patients that do not have insurance, and One of our priorities is to help those patients get connected to medical and dental home and not have to worry about cost. As an FQHC, we see patients regardless of ability to pay. That doesn't make us a free clinic. However, we base our fees based on the person's household size and income, and if the patient is unable to pay, we waive our fees altogether. As an example, mental health services at Sadler start at $3 per visit, which can't be found at other typical healthcare delivery models. Our board was committed to take action and find a solution to this rising problem. So they extended their first step, and we purchased a facility located on Trinidad Road. It's a 21,000 square foot facility. It used to be the old LIT incorporated facility, so it has some finished office space, but the majority of it is a warehouse space. We're looking at securing funding so we can retrofit the facility and make it a medical, dental, behavioral health clinic, as well as a clinic that offers vision services, pharmacy services, and laboratory services. We're taking this step because we want to be a part of the solution. We're anticipating serving 8,000 patients when this project is fully ramped up by year 2, which means that as a whole in Cumberland County will be caring for 18,000 patients in 2 years. We're literally talking about doubling our size in this period of time, and we've taken concrete steps to make this happen. 60 jobs will be created with this expansion, and we hire everything from frontline staff, being receptionists and medical assistants, dental assistants, to skilled and experienced providers offering medical, psychiatric, and dental services. The average salary of our workforce is $66,000, and we're very keen on being a part of workforce development as well. With the training programs that we have for the mid-levels, as well as for newly integrated staff, both from VOTEC programs as well as community colleges that want to integrate a health career in health. This led us to pursue the RACP application, which was due on March 31st. We have submitted our application, and we're asking for $3.2 million as part of that we have prepared and secured the majority of the match for, primarily from our purchase of the facility, as well as from the capital campaign that Laurel, here with me on the meeting, is helping us launch. This funding is critical to our ability to, one, open the facility in a timely manner as projected by the end of 2022, and bring these much needed services to the vulnerable population in Eastern Cumberland. That concludes my presentation. I'd be happy to take any questions if you have.
Okay, any questions?
Yep, thank you.
Very nice presentation.
Thank you for being here today to do this. Thanks.
Thank you so much. We appreciate your inviting us.
Okay, at this point, we'll entertain a motion for action on the suggested letter.
I will move to approve a letter of support for the Redevelopment Assistance Capital Program application being submitted by Sadler Health Center for the expansion of medical, dental, behavioral health, and other services with the addition of a site in Mechanicsburg and in Eastern Cumberland County.
Second.
It's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries unanimously. Okay, so we will get that to you very promptly. Or do we send that directly to the Commonwealth?
It's addressed as Ms. Elbrock.
Okay. We'll make sure it gets where it needs to be.
Thank you.
Oh,
Thank you.
Thank you very much.
Okay, we'll move on to item 9, the contracts and grants that were discussed at the workshop. As usual, we have room number 1 section is existing contracts and extensions, and room number 2, new contracts and such. And now's the opportunity to ask any questions or suggest any action on this?
I move to approve the contracts and grants as noted items 9, Roman numeral 1, item A, and Roman numeral 2, item A through I.
I will second that motion.
Okay, it's moved and seconded. All in favor, indicate by saying aye.
Aye.
Motion carries. Okay, we'll move on to item 10. That's the discussion and approval of criminal justice planning, intermediate punishment program, treatment programs for grant application. There's Rebecca.
Yeah, good afternoon. So this is, I think, our 24th year of this IP grant application. The total remains at $315,000, which is the same as last year. They do require that $148,000 of that be spent only on treatment services. We support 2, a partial salary and benefit of the restorative sanction assistance, inpatient and outpatient treatment, drug testing supplies with that $148,000. And the balance goes to 85% of 2 full-time probation officers that serve only intermediate punishment not inmates, clients. So the match is 0, as it always has been, and the only thing I was able to do this year is raise a bit of the coverage of one of the RSA's salaries because of new TAD monitoring services they're going to provide in the coming year. Are there any questions?
No, I have none.
All right, so we're looking for action on this today, so I'll entertain a motion.
I will move to approve the criminal justice planning and IP programs, CP DNA intermediate punishment treatment programs grant amount in the amount of $315,000.
Second.
It's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Thank you, Rebecca.
Thank you.
Okay, item 11 is we have a reappointment to the county municipal authority. And we have one recommended individual for reappointment, Tim Scott, the mayor of Carlisle. I'm not sure how long Tim's been on, but we'll entertain a motion at this point for his reappointment as recommended.
Move to approve the reappointment of Tim Scott to the Cumberland County Municipal Authority for a 5-year term effective immediately and expiring December 31, 2024.
I second that motion.
Okay, it's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Okay, moving on to item 12. We also have an appointment to the Drug and Alcohol Commission. Credentialed and provided for Ashley Rome. This is for a 3-year term. We'll look for a motion on this.
I will move to approve the appointment of Ashley Rom to the Drug and Alcohol Commission Community Advisory Board for a 3-year term effective May 1, 2021 and expiring April 30th, 2024.
Second.
It's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Okay, item 13 is an appointment to the Cumberland County Commission for Women. We have credentials in hand. I'll entertain a motion on this.
I'll move to approve the appointment of Kate Hirschler to the Cumberland County Commission for Women for a 7-month term, effective April 19, 2021, and expiring December 31st, 2021.
I second that motion.
Okay, it's moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Item 14, the general disbursement transfer authorizations. This requires action for us to pay the bills.
I will move to approve the general disbursement transfer authorizations as set forth on agenda item 14, A through F.
Second.
Moved and seconded. All in favor indicate by saying aye.
Aye.
Motion carries. Okay, report item 15, that they have accepted monthly reports as required from the Conservation District, the Clerk of Courts, the Register of Wills, the Depository, and the Recorder of Deeds. This is for all activity in the month of March. No action required on that. Item 16 is any additional business to come before the board. Anyone? Staff? If there is none, I'll entertain a motion for adjournment.
So moved.
Stand adjourned. Thank you.